How can you be sure if you have to do with a Monera case? Is there anything specific to recognize this?
Yes, there is. And again, I think there are largely overlooked Monera cases because, let's say, it's a kind of a new kingdom in our understanding. Of course, we have the nosodes, but the nosodes are prescribed on for other reasons, as an intercurrent remedy or to clear up a case or as to end the case, to finish a case, but not as a constitutional remedy. We very rarely prescribe a case, prescribe a nosode on constitutional basis. Now Monera, I think, we can of course prescribe Monera as a constitutional remedy or a vital remedy, a remedy on the 5th level. This means that the person is basically having a Monera experience in mind and body. So the experience in the body mostly is a complex picture of disease, a complex disease picture, because it's chronic. We're dealing with a constitutional or a vital Monera case. That means that's the way the patient is. So even if it's a so-called acute bacteria, or a bacteria can cause acute disease, we see the chronic version of it. And those patients, they have a lot of problems, and they mostly see a lot of therapists and doctors, and to no avail. So mostly they have a long history of vague complaints that are never cured or never healed anywhere. So the patient will talk about his disease. But a lot of people, of course, who have a lot of suffering talk about their disease and their physical complaints. It's normal. So in the beginning we are just trying to patiently wait until they will tell something more interesting. Because in the beginning we think it's not very specific. They talk about the pain here and the pain there and a lack of energy and of difficult digestion and of allergies and sleeping problems and whatnot. So all kind of vague complaints, but consistent, chronic and disabling. And they're trying to do their utter best to be healed or to be helped.
But you mean then that there's nothing else in the case?
Well, they keep talking of it. Exactly. And we're waiting for something else, and sometimes, and I did this before, you try to knock another door because we want to get to their inner core, you know. And you start the subject about their family or about their work, and of course they can answer your questions, but that's something completely different than telling you what they're feeling. Answering your questions is every person with a normal intelligence can do. Okay? But that's not case taking. That's making a case instead of receiving a case. And even then, when we try to make them talk of something that we think is more interesting, very soon they will turn the subject again to their disease. So in the end you realize that's all they have to tell. Because their mind is full of it and their body is full of it. Must be vital. So, and if you question their mind a little bit more, or if you see the way they perceive their disease and the way they cope with their disease and how they react in daily life, you see they actually have a few very, very basic interests, very basic. And by basic I mean it's staying alive, it's eating, it's growing, it's digesting, it's sleeping, it's procreating. It's very basic. And of course there's topics for all of us. We have to stay alive. But for them it's like almost limited to that. So they have a big interest mostly in food. And in food, special diets, clean diets, eating a lot to be strong. Because they feel they need it. They have to eat a lot. Which is true for a Monera, for a bacteria. They feel they have to eat special foods, rich foods, or they have to avoid foods, or whatever. They're very focused on special diets, and they will try all diets. They will eat no fruits or only fruits, or, you know, they will eat macrobiotics. They will have tried every diet. And very often they eat a lot because they think it's necessary, and they focused on eating. And when they go somewhere, they will think about eating, or they will carry food with them. They have this basic occupation with, am I healthy or am I not? And they will consider other people as normal because they're healthy, and themselves as abnormal since they're unhealthy. So they ask themselves, what did I do wrong? So they consider it a personal flaw, like maybe it's inherited, maybe it's something in my lifestyle, maybe it's something in my diet, maybe it's something in my environment. So they're looking for the reason in themselves, what is wrong with me that I feel this pain, or I don't have energy, where other people can do this thing, or they can eat this, and they don't have any problem, and I have a problem, so something must be wrong with me. And they try to be normal, and for them normal equals health. So the whole polarity is healthy and sick. That's their basic interest in life.
Okay.